Physicians dedicate our lives to the care of others, and this often doesn't end when we leave work, but extends to our family and friends, other projects and demands that lead us to overextend ourselves until we feel like butter spread over too much bread. This has become acutely true during this pandemic, so psychiatrist Dr. Dimitrios Tsatiris discusses how we can work more self-care into our lives without the guilt. We start by defining self-care. What can happen to us if we forgo it for too long? We then go into all of the internal and external obstacles we face to self-care, and he gives ideas for overcoming those obstacles. Dr. Tsatiris is a board-certified psychiatrist in Cleveland, Ohio, who specializes in the treatment of anxiety and mood disorders. He completed his residency training at University Hospital's Case Medical Center, where he served as chief resident, and he also is certified in psychodynamic psychotherapy from the Cleveland Psychoanalytic Center. When he's not at work, he devotes his time to his wife and 2 young children, and doesn't neglect his self-care. He can be found on Twitter at Dr. Dimitrios, MD.
Welcome to the Physician's Guide to Doctoring, a practical guide for practicing physicians. Dr. Bradley Block interviews experts in and out of medicine to find out everything we should have been learning while we were memorizing Krebs cycle. The ideas expressed on this podcast are those of the interviewer and interviewee, and do not represent those of their respective employers. And now, here's Dr. Bradley Block.
Shopping for disability insurance can be complicated and time-consuming. Wondering if you're getting the best prices and discounts while in training can make the process even more overwhelming. Pattern believes doctors have more important things to do than spending hours sorting through numerous insurance options. This is why thousands of doctors trust Pattern to help them compare and understand the insurances that they are buying. They do this in 3 simple steps. First, request your quotes online. Second, compare your options and ask questions. And third, apply risk-free. Be confident you have the right policy so that your income is protected. With discounts for doctors in training and some relaxed requirements during the pandemic, now is truly the best time to request your disability insurance quotes with Pattern at patternlife.com/partner/PGD. Again, that's patternlife.com/partner/PGD for Physician's Guide to Doctoring. Dr. Dimitrios Tsatiris, thanks so much for being on the podcast.
Brad, thank you so much for having me.
So a couple of episodes ago, we had Robin Simon on the show. She had created this film, Do No Harm, which is about the prevalence of physician suicide. And the film was made before this pandemic. And we discussed all the pressures that are on physicians and what a huge issue that is. But it's a different environment now. A lot of those issues that were there have now gotten significantly worse. So I was thrilled when you reached out to me to be interviewed on the podcast about ways that we can help cope and make it through. So first, why was it that you felt the need to reach out? Why did you think the perspective of a psychiatrist, I think it's fairly apparent, but I'd like to hear it from you, was so important for our physician audience?
Brad, thank you for having me on again, and thank you for the question. Absolutely. Practicing medicine has been challenging, right? It's a long journey to become a physician. It's a lifelong commitment for us that we decided at a very young age. It comes at a high cost. So pre-COVID, practicing medicine was challenging. Then you add a pandemic on top of that, and the challenge of being a physician has become insurmountable. There are 3 components that we're dealing with right now. We're observing an increase in abrupt change. We're observing an increase in uncertainty in our lives. And we're dealing with a lot of loss. And you add that triad, and it's made the practice of medicine that much harder.
And so then the question is, what do we do? How do we, what's the process for coping with all of that? Right? So as physicians, we generally put everything else before ourselves. And we've done this from the beginning, right? We've done this from training, all that delayed gratification. Yeah. If I just study enough, then I can get into med school. If I just study enough, I can get into the residency of my choice. If I just study enough, I'll be able to get into a fellowship. If I just study enough, I can be, assistant professor. And then it's always, and then for those of us with families,
oh yeah,
get home from work, you give everything to your patients, you get home from work, and then you give everything to your families. and then you go to sleep. Or in my situation, you get home from work, you give everything to your families, then you give everything to your podcast, and then you go to sleep, right? So how do we cope when we're spending all of that time just giving?
Yes, Brad, you're describing the culture of medicine, which is characterized by it's a culture which promotes self-sacrifice. That's what you're describing. What has been promoted in our culture is taking that overnight call, taking that extra shift, going the extra mile, taking on that extra course, right? Taking on that extra patient caseload. And the antidote to that is starting to engage in self-care, making oneself a priority, acknowledging that we have limits and that we're practicing medicine beyond these limits. And if we continue to practice beyond our limits, we really predispose ourselves to mental health difficulties, to depression, to anxiety. And it's important to start to set boundaries with ourselves by saying, hey, I'm practicing beyond my limits and I need to focus a little more on myself and engage in self-care. In my opinion, self-care is not something that has been encouraged by the culture of medicine. I don't recall that in my medical training or in my residency training. Do you, Brad?
You know what I recall? I recall being on my surgery rotation and them saying, you know what the worst thing about Q2 is? Missing half of the good stuff.
Wow.
Right? Like you should want to be in the hospital 24/7, and if you don't, there's something wrong with you, right? That's what was bred into us, and yes, that was not me. That was never me.
So you can imagine that self-care is not natural to physicians. It's just not, and you can imagine that. Because of the culture that we've been exposed to for all these years, we experience some feelings that prevent us from pursuing self-care. We experience feelings of obligation and we experience feelings of guilt. And these psychological factors, they make it really hard for us to engage in self-care, which is necessary to provide care to the best of our ability to patients.
Well, let's talk. What is self-care? Because for me, self-care is one, actually, it's this podcast, right? It's being able to have a creative outlet that is separate from my practice, separate from my family. Like it's its own thing. So it allows me to toggle away from what I'm normally thinking about or what's normally on my mind. I'm also into fitness. So the few experiences I get nowadays, that's important to me, but that's me. What qualifies as self-care?
Yeah, so self-care is defined as the practice of taking action, healthy action, to preserve and even improve your health. So that's self-care. And there are different types of self-care. So what you're describing as far as exercise is an example of physical care. Physical self-care. There is also emotional self-care, such as the practice of journaling or listening to music or playing music or engaging in art. There's also social self-care, reaching out to a loved one, connecting with a peer in medicine. There is spiritual self-care, for example, engaging in prayer or meditation. And there's also professional self-care, such as setting boundaries with work, planning a day off. So these are different examples of self-care.
But you mentioned guilt, right? Anytime I'm not doing one of those things, not doing one of those things, but anytime I am doing one of those things, right? I'm either not working, I'm not with my family. Like in order for me, at least the way my day goes, I have 3 small kids, right? My oldest just had his 4th birthday and my youngest is 8 months old. So they're all 3 of them are squished, separated by 3 years and 4 months. They're all packed together. None of them sleep. So when I wake in the morning to when the first one wakes up, which is around 6 o'clock in the morning. We do bedtime, which lasts like 7 to 8. In between there, like I wake up, my wife generally gets them in the middle of the night. Sometimes I do as well, but then I let her sleep in the morning. So I get them when they first wake up, eventually hand them off, go to work, come home from work with them, put them to bed, and then I am exhausted. So anytime that I'm not with them, right, or I'm not working, there is no time. So then I have to put them in front of the TV, right? Because my wife's been with them all day. Like she's got all other stuff she needs to do. She needs a break. Then I feel terrible because, the TV is the enemy. Screen time is the enemy. And American Academy of Pediatrics. You're a terrible parent if you put your kids in front of the screen. So then I feel guilty about it. But then I'm not taking care of myself. So how do I get past that?
Absolutely. So if I may decipher your comments, there's a couple layers there that I think we need to peel, if that's okay. The one is, quote, I don't have enough time to engage in self-care. We have this impression that self-care is time consuming. I would argue that self-care can even be 5 minutes, like 5 minutes of deep breathing, 5 minutes of meditation, right? So self-care does not have to take a lot of time. It can even be a 5-minute exercise in quiet, in isolation. And those 5 minutes will actually help you be more effective and more efficient as a father, as a husband, and as a physician. So that's the one thing I want to point out. It's okay to start small when it comes to self-care. We don't have to necessarily have 1 hour of care off the bat. That would be nice, but it's okay if we start with 5 minutes. Now let's talk about guilt. Let's pivot into that. You mentioned guilt. And what is guilt? So guilt is feeling bad, feeling like you're doing something wrong. And guilt is the difference between what we do and what we think we should be doing. It's the difference between our behavior and our expectations. So in your example, to decipher the guilt, you're doing all this work as a husband, as a father, as a provider, as a physician. That's your behavior. But then your should is, well, I cannot stop. I should continue to do more for other people, and I should not engage in self-care because look at all my responsibilities. So that gap is what creates guilt. And there's only 2 ways to cope with guilt in order to lower that difference. One is to increase our behavior and work beyond our limits. That's one way to cope with guilt, right? Just to take on and on and on, more and more and more. Or to examine our expectations and maybe lower those expectations to a more reasonable, realistic, and sustainable level. When we examine your day and when we say, hey, I don't have any time for self-care, or maybe I shouldn't engage in self-care because look at all these responsibilities that I have, would a few minutes of self-care per day help you be a more effective and efficient father, husband, and physician?
So I think at least how it would translate into my day would be basically having pre-scheduled time. Mm-hmm. So I would feel less guilty about this if we pre-scheduled it. Like I get home from work with the kids for a half an hour, then they're on the screen for a half an hour, and then we have dinner, right? Like if that half an hour were pre-scheduled and that's what our intention was all along, rather than just being like, oh, I'm exhausted. Can we just put the TV on? And then I feel guilty for not having enough energy for putting the TV on. Mm-hmm. Right? If it was pre-planned, the outcome is still the same, but now no guilt.
Mm-hmm. Yes. So a couple things here. Absolutely. So number one, pre-scheduling self-care, that's important to do. What my wife and I do, for example, Sunday nights, we sit down and we kind of plan the week, and we look at any meetings that I have or any responsibilities that she has, and we'll allocate time for each one of us as far as self-care. Now, and again, it may not be the ideal time slot, and it may not be the ideal duration of self-care, but something is better than nothing, right? And when we have these conversations, what we're really looking for is reciprocity and win-win. When she has self-care and she has more energy and she's more efficient and she's more effective, I benefit, and vice versa. When I engage in more self-care and I get to be more efficient and effective, then she benefits. So we're really looking for win solutions when we have our weekly meeting, the two of us. So that's one element. Number two, as far as guilt, again, let's examine the expectation that I have all this work to do, that I feel guilty putting the kids to watch TV. Let me ask you this question. If somebody else were to be expressing to you, Brad, that they feel guilty about having their kids watch, 30 minutes of TV because they're so drained from being a physician and a husband and a father, would you tell them to feel guilty, or would you tell them to, it's okay, it's okay, give yourself permission to watch, for your kids to watch a little bit of TV? What would you tell them?
You're a terrible parent. You shouldn't consider putting them in front of the TV. It's rotting their brains. What are you thinking? No, it's always, our internal monologue is always going to be worse than anything we would tell our friends, right? If we
Yes.
talk to ourselves the way if we talk to our friends the way we talk to ourselves, we wouldn't have any friends. I'm fond of that expression. And I see what you're saying. It's the same in that regard, right? Like,
Yeah.
give yourself a break. Give yourself a break. And you know what? My wife constantly telling me that. It's fine. It's not a big deal.
Yes.
You're not getting that much screen time. It's fine. Don't be so hard on yourself. Your expectations are too high. You're already a successful physician. Why do you also need to have a podcast? Your expectations are too high. So this is how we work, right? Like you're writing a book. Being a successful doctor and parent wasn't enough. You wanted to do so. This is how we got here. This is how we became physicians to begin with. This is our expectations of ourselves.
But are they fair and realistic? Do
Yeah.
you see what I'm saying?
Yeah.
Or are they harsh? So,
Yeah.
for example, if you're going to tell someone, like a dear friend, that, it's okay if your kids watch 30 minutes of TV. And by the way, my kids just watched 30 minutes of TV from 7 p.m. to 7:30 p.m. So if you're going to give someone else permission to allow their kids to watch TV, then why don't you give yourself permission to allow your kids to watch TV for 30 minutes? Why the double standard? I think it's an interesting question that promotes reflection and introspection. So I think if we can lower, and I apologize, Brad, I think if we can lower the expectation to something a little more realistic and a little less harsh, I think that lowers the difference between expectations and behavior. And I think it helps us cope with guilt. Now, guilt, a little more on guilt. It's okay to have a little bit of guilt. I'm a big fan of Aristotle and his rule of everything in moderation. I think the absence of guilt is problematic. That's how you end up with antisocial personality disorder, because there's no moral compass. What we're trying to do is just move the guilt from being excessive and unreasonable to something a little more moderate, a little more realistic. Are there times that I experience guilt? Absolutely. I'm a human being with a moral compass. Absolutely. But I think if we can move the guilt to something a little more in the middle, I think that will allow us to make self-care more of a priority. Because again, guilt is a barrier to self-care.
But don't you think that the way that we got here, right? The reason that we are successful physicians, right? We're in one of the most competitive fields, right? We had to be at the top of our classes at all times. Otherwise, we wouldn't be in the positions we're in. That you have to have these high expectations of yourself. And if you didn't have these high expectations of yourself and these times that you're reflecting and saying, I can do more, I should do more, then you're going to stagnate, right? How do you juxtapose one on the other? Like not feeling guilty about not pushing yourself, but still pushing yourself to do more and achieve more, because that's how we get here, right?
That's a great question. That's a great question. There's a difference between I can do more and I want to do more and I want to challenge myself versus I should do more. When there's a different feeling, right? Should it's associated with guilt. It's associated with shame. It's associated with I'm not good enough unless I do A, B, and C. Can and want, it's more giving yourself permission to push yourself to new frontiers and to engage in self-growth and to take on new challenges because you want to see what that's like. So like, for example, myself, I write on the side. I don't write because I should write. I write because I want to write. I write because it allows me to reflect on my thoughts and to really crystallize them. I write because it helps me become a better physician by reflecting on what my patients go through and what am I going to tell my patients. So there's a big difference between I want to do this, I want to do more, and I can do more, and I want that challenge versus I should do more.
I see. So it's a subtle difference, but it's I'm satisfied with what I have and what I'm doing. But what else can I do to push my limits? But at the same time, not pushing it to the point where you're neglecting other things.
Absolutely, absolutely. It's approaching life from a state of abundance, from good enough. Yeah. Like what we have, we're good enough. We're blessed. We have our health. We're physicians. We get to make a positive impact on the lives of other human beings. We have our families, like we have these blessings, but it's okay to say, well, what would it be like if I wrote, or what would it be like if I took on this challenge? That's a different mindset than I should do more. When you say should, it reflects, hey, what you're doing is not good enough. Your behavior, what you've done so far is not good enough. You should do more. You're obligated to do more. Should is associated with guilt and shame. But when you approach it from a different angle, like, hey, I'm happy with what I got, but you know what? I want this challenge. I want to give it a shot. It's a different mindset, and there's a different emotional experience associated with that mindset.
What about the pandemic, right?
Mm-hmm.
In terms of physician practices right now, some physicians are having their pay cut, even though they're seeing their risks go up and their schedules get busier. Some people, because people are afraid to go to the doctor, they're seeing their schedules wiped out and their income doing the same, and their practices are in jeopardy. I'd like to talk a bit more about the issues as they relate to the situation we're in with the pandemic, right? Self-care in the age of COVID-19. As a psychiatrist, how have you seen things change from pre to post with regards to self-care and barriers to self-care?
Well, I'm observing a spike in pressure on physicians. Absolutely. I mean, again, our jobs have been challenging pre-COVID. I mean, last I checked, the burnout rate was over 40% among physicians. And then when you add this global pandemic on top of it, we're having pay cuts and a reduction in job security, and many physicians are putting themselves at risk. There's definitely an increase in pressure, and this increase in pressure is making physicians more vulnerable to depression, to anxiety, and to other mental health difficulties. And when I say self-care, another example of self-care would be, for example, knowing that you're not alone, not isolating, reaching out to peers, right? That's another example of self-care, like socially making sure that you're not alone, that you're connected well with other people in the field. In addition, it's not I understand that people are putting more and more expectations on us as physicians, but at some point we also have to know that we have limits as human beings. And at some point there have to be some boundaries that I'm sorry that I can't take on this extra shift. I really apologize. I can't do A, B, or C. We have our limits, and it's important for each and every one of us to examine what these limits are, because when we go beyond these limits and we're spread too thin, we're vulnerable to mental health difficulties. So this is a life example from my personal life, that Saturdays and Sundays, they're devoted to my family. That's when I'm a husband. That's when I'm a father. That's when I go to church every Sunday. That's what's important to me, those roles, those responsibilities. And my work knows that that's my red line. Are there opportunities to work on the weekends? Absolutely there are. I could run at the hospital. There's always opportunities to take on more work as a physician, as a psychiatrist. But that's the boundary, and it's my responsibility to acknowledge my limit and to set that boundary with other people and with the hospital, for example. And there may be consequences when you say no. There may be consequences, but you have to be willing to live with that at the end of the day. You have to, at the end of the day, be able to look yourself in the mirror and know that you're being true and authentic to yourself. So part of coping with this pandemic is boundary setting.
Yeah, we've definitely said that in other episodes, where it's ingrained in us to say yes to everything.
Mm-hmm.
And in fact, when you're in high school, would you like to be involved? Yes. Would you like to do work on yes. Would you like to college? Same thing. Yes. Everything. Yes. Any opportunity you get. And I don't disagree with that, because frankly, unless you're working to support your family, you're not that busy, right? Take advantage of any opportunity you can take advantage of when you're that young. But eventually, you reach this inflection point, and it becomes too much. And we've gotten so conditioned to saying yes to everything that it's really hard for us to say no. And we are reluctant to say no. And there's something wrong with us. And we feel, there's that word, guilty for saying no. And I think we have to give ourselves permission to say no. And one phrase that I like to repeat is, there gets to a point in your life where every time you say yes to something, you're saying no to something else.
Amen.
Right?
Amen.
So if
That's
you say
perfectly
yes
said.
to rounding on the weekend, you have to also say no to seeing your family. So you have to sit there and look your children in the eye and say, I am choosing to round in the hospital rather than hang out with you.
Doesn't that hurt when you say that? That
Yeah.
stings when I hear that.
Yeah, right? So
doesn't that hurt?
Yeah, but I mean, you can't quit completely because you have to hang out with your family, right? Like you need to make a living, right? Like there are boundaries to that as well. There are boundaries to your family as well. But I think we all need to give ourselves permission to just say no. And at least in my life, I've gotten to the point where I say no with a capital N and a capital O and an exclamation point afterwards, and maybe bolded and underlined as well.
Yeah, and what I like to tell my patients and fellow colleagues is that no's are unavoidable, and we get to pick the recipient of our no. You know, you can say no to an employer, to work, or you can say no to your family, or you can say no to self-care, but the no is unavoidable. Someone's going to get a no from you. But in the way we're ingrained as physicians, you know, based on over a decade of training, is that it's easier to say no to your self-care. It's easier to say no to you as an individual than to a spouse or the hospital administration, right? Continuously saying no to yourself, eventually it's going to come at a cost. When we're spread too thin beyond our limits, anxiety's right around the corner. It's right around the corner. It's unavoidable. At some point, we have to take ownership of our no's, and they can't always be directed at ourselves, but they have to be directed at some other people, right? So here's how I look at boundaries. I think of boundaries as a fence, and that fence has a gate. And what does a fence do? It defines ownership and responsibility. So a physical fence tells us, you know, Brad, where we can mow the lawn and where we can plant flowers, you know, in our properties. And, you know, that gate, it's one of the few things that we have some control over. And we close that gate by saying, no, I can't take on this extra responsibility. Thank you for the opportunity, but no. And we open the gate by speaking up and asking for help. Like boundaries is a two-way street. We can either say no or we can ask for help, which is also very hard for us as physicians. Because again, our culture, the culture of medicine is that, yes, I got this, put it all on my back. You know, I'm going to engage in these Herculean and heroic efforts to go above and beyond for everyone else. So for us to be humble enough to say, you know what, I need some help here. I need help from my spouse. I need help from the hospital. I need help from a peer. That's really hard for us to do.
But it can be insidious, I think. Mm-hmm. The point at which you're sacrificing your own self-care, right? How do you know you're there? It can sneak up on you.
Yeah.
Are there any signs we should be looking for to know? Because we might be, you know, bopping along in our life. Everything's good. You know, everyone's got their own stuff that they want to work on. But like, you might think, no, I'm not neglecting my self-care. I am taking care of myself. I'm taking care of family. I've got everything at work. But it might not be the case. If someone was looking from the outside in, they might be like, you are not taking care of yourself. You are falling apart. At least starting to. Is there anything that we can look for in our own lives to reflect to see if that's sneaking up on us?
Yeah, you know, that's a really good point. And thank you, Brad. It's almost like we drift into a hypnotic state of not taking care of ourselves. It's not like we don't go from 100 to 0. It's one of those slow, gradual processes. It's almost like that frog that's in pot of water, and the water, the
boiling
temperature
a frog.
Yep. Exactly. And
how do you boil a frog?
That's how we've been trained. It's part of the culture of medicine, right? It doesn't happen overnight. It's years of being ingrained slowly but methodically. So some of the symptoms that I observe, and number one, sleep. If your sleep is choppy, or if you're having a hard time falling asleep because you can't shut your mind off, or staying asleep, or you're waking up earlier than usual because you have all this work to do. So that's an example of not practicing self-care. If you're more irritable, more on edge than usual. Maybe you're snapping at the kids, or, you know, maybe you're a little more irritable. Your ability to tolerate noise and frustration is not the same. That's another example. If you're finding yourself using maybe some unhealthy ways to cope, you know, maybe we're having an extra drink here and there, you know, maybe numbing our feelings by just playing video games, for example, right? So just, you know, engaging in behaviors that are uncharacteristic, you know, maybe not connecting with like a spouse or our kids like we typically do, or with a peer, isolating it a little more. So these are all like signs that, hey, maybe we need to do some work to recalibrate and rebalance things a little better.
And then if we do figure that out, right? Once we do notice that maybe I'm snapping at my kids a little more.
Mhm.
Maybe I've got some insomnia. In terms of the type of self-care, is there an order? And I think the first thing you mentioned is sleep, right? Like in terms of self-care priorities, at least I would think, I know a little about sleep, ear, nose, and throat, right? We're
Mhm, mhm.
sleep
Yeah,
surgeons.
definitely.
I would think that sleep would be the number one priority. Like get your sleep in order first before you decide to start exercising or journaling or meditating or like make sure that you are getting adequate sleep. Like find
Mhm.
a way to either go to bed or something to, we're both in situations with little kids. It's hard to
Sure.
do, but like as best you can, first priority would be sleep. Would you agree with that? Or do you feel like there are other priorities or it's different for each person?
Yeah, I think it's situational. I mean, sleep is important, no doubt, but I think it's situational. So for example, for myself, my job is very sedentary, and I take on maybe some negative feelings and emotions from patients as a psychiatrist, right? So for me, that negative energy builds up in me. So I have to release that energy, and I have to be physical. So I heavily rely on exercise 4 to 5 times a week. Now, for somebody else who's more of an extrovert, but they're feeling lonely and they're feeling isolated during COVID, they might want to engage more in social self-care. Like, for example, reaching out to loved ones, scheduling time every day to have adult conversation, right? Somebody who's a little more spirit based, maybe they have a strong faith, they might want to focus a little more on prayer, right? So if somebody's a little more into the arts and into the music, they might want to go down that road. So I think it's more of an individualized approach. I think it takes a little bit of understanding the self, being reflective of what you enjoy, what you like, what you don't like, and responding accordingly. So for example, somebody who's an introvert, I wouldn't recommend social self-care. Like they need some quiet time, right? They just want to be left alone and just be with their thoughts. So I think it's knowing the individual and knowing their circumstances and designing it accordingly.
What have you seen from physician colleagues in terms of resistance to self-care? And how have you convinced them, or how would you go about convincing someone? So if there were a listener out there who said, that's all well and good in concept, but in my life, it's just not going to work. It's not going to happen. I'm too busy here. I'm too busy there. And I know you said, 5 minutes, it can be 5 minutes, but then, they're going to roll their eyes at that. Listening to this podcast while they're driving home, they see all their obligations in front of them. Have that conversation with the reluctant physician who doesn't see this self-care as realistic.
That's a great question. And it depends on their circumstances. So somebody in our situation, Brad, where we're married with spouses and kids, I think it starts with communication. I think it involves approaching our loved ones and saying, hey, here's how I feel. Here's where I'm at. What can we do to allocate some time for me and for you so that we can both be a little more efficient and effective? Because again, whenever we have a conversation with a loved one, we're looking for win-win solutions, right? We're looking for a solution where there's reciprocity. We're looking for empathy, for really understanding our partners and for helping them be the best version of themselves. So in my situation, your situation, I think it would start with communicating with our significant others. For someone else who maybe is alone, is single, really looking at their day, writing it out, like reflecting on the day, the week, and saying, really, I cannot find 5 or 10 minutes of even doing some deep breathing or some meditation or to listen to some music. I mean, within, we're awake, 16, 18 hours a day. We really cannot find 10, 15 minutes to engage in self-care. I guess I really want to challenge that. I find that hard to believe. And if we can't find 10 or 15 minutes, it's proof, it's evidence that we're really spread too thin, that we're not setting boundaries. Like if we can't find 10, 15 minutes of time to put fuel in our tank so that we can continue to serve patients, serve our families, serve the community, we're off balance. There are no boundaries at that point. We've been saying no to ourselves too much.
And is there anything, to wrap this up, is there anything that you would want to say to our audience with regards to self-care that is specific to COVID-19, to practicing medicine and social distancing and the risk that we're putting ourselves in, and we are spread too thin. We're more stressed at work. We're more stressed about our finances. Like everything in our life that was stable is now unstable.
Yeah.
The risks are higher. The stakes are higher. Life has just gotten a lot harder. We're distanced from our friends and family. Like this is really tough. This is really hard, right? What would you say to us? I mean, you've really given us a great message, which is find the time, make the time. You're worth it, and you'll be better for it. And I love that. But as just a parting message, what would you say to our listeners?
Well, the first thing I would tell them is thank you. I mean, the majority of us, we're continuing to be front lines and continuing to serve patients during a difficult time. And I just want to say thank you to everyone for their hard work. Number two, we're dealing with a pandemic. And again, the pandemic means that there's loss, that there's change, and there's uncertainty. And it's a very difficult cocktail. And because of that, I think it's okay for us to acknowledge and validate that this is really hard and that there are going to be rough days for all of us. Whenever there's uncertainty and change, anxiety goes up. Whenever there's loss, depression goes up. So to expect not to have some difficult days or, maybe an increase in stress and depression for all of us, I don't think that's realistic. This is a really difficult time, and I think it's okay for us to acknowledge that. But what happens when we acknowledge that? There are studies that show that when we express our emotions, it takes a lot of the intensity, the teeth away from that emotion. It really does. The act of validating and the act of expressing and saying, I'm stressed, I'm overwhelmed, to even be able to say that, to identify the emotion and to express that, studies do show that it takes a lot of the edge off the emotion, away from the emotion. And number three, again, when it comes to self-care, it's each of our responsibility. We talked about boundaries, and boundaries mean ownership and responsibility. And we have to take that ownership, each one of us individually. That self-care, like my self-care is my responsibility, and Brad, your self-care is your responsibility. And we really have to take ownership of that. We really have to assume that responsibility. And we have to engage in these conversations with peers, with loved ones, even with employers if we have to set those boundaries and look for win-win solutions that will promote our self-care and which will ultimately make us better physicians and better partners and better parents and better members of our community.
Well, thank you. There's really a lot of great advice for the physician audience. And I know after we're done with this interview, I'm going to march upstairs and have a conversation with my wife about where we can both schedule in. She's not a physician, but she definitely, the kids are home all the time, right? There is no childcare right now. So we both need to be sure to schedule our own self-care and not feel badly for parking their little tushes in front of the TV while we take care of ourselves. So thank you for giving us permission to do that. And thank you for all the work that you're doing. Where can people find you online?
People can follow me on Twitter. My handle is at Dr. Dimitrios MD, where I express my different opinions. I'll publish some articles on there as well. So that's a good starting point. And again, Brad, I really want to thank you for the opportunity to be on your podcast. And I really want to congratulate you on the really good work that you're doing. The work that you're doing is very important, and keep it up. Keep up the great work.
Thanks. I appreciate it.
That was Dr. Bradley Block at the Physician's Guide to Doctoring. He can be found at physiciansguidetodoctoring.com or wherever you get your podcasts. If you have a question for a previous guest or have an idea for a future episode, send a comment on the webpage. Also, please be sure to leave a 5-star review on your preferred podcast platform. We'll see you next time on the Physician's Guide to Doctoring.